Hello everyone, welcome to Phonics. So today we'll be studying about biomedical waste management. So it's a very important topic in every exam, be it INICET, FMGE or NEETPG. You can expect at least two questions of it. One question will be a basic question and other one will be advanced question. Basic question will be helpful for you to ensuring your selection and the advanced question will help you get a better rank. So in this video, we'll be targeting both of these questions and I can assure you that you will be able to answer both of them. So biomedical waste management, what it is basically. So the waste from the hospital is discarded into various color bins and it is further processed. So we'll be studying about both of these aspects here. So in biomedical waste management, the four color bins in which the hospital waste is discarded are yellow, red, blue and white color bins, and all the general waste is discarded in black color bin. So first of all, we have to learn what waste is discarded in which color bin and how it is further processed. So we'll be studying about red, blue and white color bins first, and whatever gets remain will be discarded in yellow color bin. So in red color bin, anything which is recyclable, made up of rubber or plastic is discarded. For example, urine bags, vacuum cleaners, gloves, plastic syringe. And if we talk about COVID-19, so there are some specific things which are used in hospital like the hazmat suits, face shield, goggles and splash proof apron. All of these are discarded in red color bin. So how it is further processed? So it is processed by the process of autoclaving, microwaving and hydroclaving, and which is further processed by shredding and mutilation and ultimately get recycled. So here an important PYQ comes where they ask whether it is sent for landfill or not. So the answer is it is not sent for landfill. So it's an important PYQ. You have to keep in mind. And there are various other numerous PYQs which are asked what are the examples of red color bin and which is discarded in red color bin, etc. So now comes the blue color bin. Blue color bin is actually not a bin. It's a cardboard box with a blue label. So it's a potential new question from my end. And one more thing I would like to bring your notice upon here, that it can also come an image based question. So you have to keep this in mind. So what all is discarded in blue color bin? So the answer to that is glass, metallic body implants and pacemaker. So how to remember that? It gets confusing many a times. So how to remember it with a simple mnemonic or a trick? Let's suppose an old man who is wearing glasses, and since he is old, so maybe he is also having a pacemaker. He was going somewhere and by chance he fell down. So due to that he got some injuries like some bruises and fractures. For bruises you can remember it like bruises for blue, and fractures, for those fractures he required some implants. So then how it is further processed? So it is further processed by sodium hypochlorite, autoclaving and microwaving, and ultimately it gets recycled. So then comes the white color bin. So it's a puncture proof container, so you can easily guess it. All the things which are sharp and metallic will be discarded in white. So for example, syringe plus needle. So here one important thing you have to keep in mind, and sometimes it gets confusing. If in the question it is mentioned as syringe plus needle, then you have to answer it as white, and if only syringe is written, you have to answer it as red, because only syringe is made up of plastic which will be discarded in red, and syringe plus needle, as needle is a sharp, so it will be discarded in white. Now some more important probable new questions, P and Qs, are that insulin syringes are the fixed ones, so they will be discarded in white. So it's an important new question, and same goes with the interosseous needle. So how it is further processed? By the process of autoclaving or dry heat, then shredding and mutilation, and ultimately by landfill. So now by now you would have understand that what is discarded in red, blue and white bin. So the remaining one will be discarded in yellow. So what all comes in yellow? So like human and animal waste, chemical waste, laboratory waste, microbiological waste, vaccines, liquids, soiled gauge piece, linen, plastic cast, plaster cast, etc. They all are discarded in yellow color bin. Okay. So now a very important probable new question also is here. What is that? See, any expired drug or any cytotoxic drug which are usually used in the chemotherapy regimen. So these all drugs are also discarded in yellow color bin. Okay, and these drugs, the expired ones, are sent back to the manufacturer And also one more thing for the cytotoxic drug you have to keep in mind is that along with them, the vacuitainer in which they were kept and everything which is used to give them, they all are discarded in yellow. So it's a very important question. If you get it right, I can assure you it will be a huge bonus for you. Then comes the blood bag. Another, it is also an exception and it's also PYQ. Okay, so the blood bag is the only bag which is discarded in yellow. Usually bags are discarded in red. Okay, so now we have to see how the yellow color bins are further processed. So usually they are further processed by incineration more than plasma pyrolysis, and then they are sent for landfill. So usually we'll see the yellow color bin things which are discarded there are sent for pre-treatment. There's some few things, few waste material which are not pre-treated. Some of them are blood-soaked dressing material, okay? And similarly urine bag also. This is also not sent for pre-treatment. So by now you would have easily understood which bins and which waste material is classified in which color bin and how they are further treated. So I can assure you that most of the questions, even the advanced one, would be answered by this knowledge only. And there are few here and there things which are further explained here. So like plastic wrapper of folies is discarded in black color waste, black color bin. So why it is that? Because it's a general waste. So all the general waste is discarded in black bin, and it's also a PYQ. Similarly, once they asked about mercury, so it's also an important PYQ. Okay, so they asked how will mercury be processed if it is spilled on the floor. So answer of that question is that you have to pick it up with the cardboard, okay, then discard it in water. Okay, if a blood spill is there, then answer to that is by 1% sodium hypochlorite. Now there is also a probable new question here comes, like we are treating all our bin materials by one or the other way. What are the low heat system and what is the high heat system? It's a very important question for INICET especially. They can give you an all except type of question. So what is low heat system? In which it's basically a temperature difference, nothing much, but you have to remember it. So the low heat system consists of autoclaving, microwaving. And what does high heat system consist of? It consists of incineration, plasma pyrolysis, hydroclaving, and dry heat sterilization. So there are some exceptions to biomedical waste. So what are those exceptions? Like radioactive waste, municipal solid waste, lead acid batteries, electronic waste, and hazardous waste. Okay, so what does hazardous waste contain? It contains the hazardous chemicals and microorganisms. So these are not put into the bins. Okay, so these are considered as exceptions to biomedical waste management. Then comes one more thing, like how will you disinfect sputum? So there are few methods. This is also again a probable new question and which can come in INICET, like all except type of question. Okay, so how you will disinfect sputum? So there are three methods. What are those? Autoclaving or boiling if there's too much of sputum. Okay, and with the help of 5% cresol if you collect the sputum in the cup, and by burning if it is on tissue or the gauze piece. Okay, then few more things you have to keep in mind is on-site treatment disposal facility is made if the biomedical waste treatment facility is more than 75 kilometers away. Okay, and there is also a process known as inertization. What is inertization? It is done to decrease the toxicity, and what are the components? It is again a very important question and can be asked in INICET. Okay, including in FMGE and NEETPG, because nowadays the trend is changing and you can easily see new questions being asked by NBA as well. Okay, so what are the components of inertization? So it is basically 65% waste, 15% cement, 15% lime, and 5% water. Okay, and the reason for inertization is it is done in order to decrease the toxicity. And then comes the COVID-19 waste, 1% sodium hypochlorite. It is same as blood spill if you can see. Okay, and it is used to disinfect the bins. Okay, and what is not incinerated? So I have already taught you this above. I'm just compiling it here. The sharps, the high pressure containers, reactive chemical, heavy metals, polyvinyl chloride, photographic and radiographic waste. So these are not incinerated, although I've taught you above also. So this makes you comes to an end to biomedical waste management. I hope you got to know about all the aspects of all the color bins and all the questions. And if you just go through this slide before your exam just once, I can assure you that you will be able to answer all of the questions. You can also try solving any of the custom modules or QBank modules anywhere. So you will be able to answer most of the questions. So comment down below what next topic you want to learn. We'll simplify it for you. All the best. Best of luck for your future exams. Thank you.